Hello, welcome to Pediatric Pulse. Today we are learning about endotracheal tube selection in pediatrics. This session is important to everybody who deals with a critically ill child, either in ICU for pediatrics, NICU, or that is the neonatal ICU, or even in theater and sometimes in outpatient department where you need to intubate before taking the child to ICU. Let's start by reviewing indications for intubation. The first one is apnea or inadequate respiratory drive. The second one is infective respiratory effort, for example, in Guillain-Barré syndrome, lung failure in pneumonia, airway protection for patients in coma, upper airway obstruction, for example, in epiglottitis, to facilitate mechanical ventilation, and also to protect and maintain airway during anesthesia for invasive procedures. In infants and younger children, the cricoid ring is the narrowest part of the upper airway, and cuffed endotracheal tube is commonly used, while in older children and adults, a cuffed endotracheal tube is used. In this slide, kindly appreciate the uncuffed endotracheal tube. And in this slide, appreciate the cuffed endotracheal tube. In this slide, it is showing ETT selection. I've divided the table into four: the age, the ETT size with internal diameter in millimeters, the ETT length in centimeters for oral, and the ETT length in centimeters for nasal. For prem neonates, we use ETT size 2.5 to 3.0 with an oral length of 6 to 8 centimeters. For the nasal, it's not recommended because of their small and delicate nasal passages, which are at risk of trauma and bleeding. For term to 6 months old babies, we use 3.5 to 4.0. Then for the oral length, it's 9 to 11 centimeters. And for the nasal length is 11 to 13 centimeters. For 6 months to 12 months old babies, we use ETT size 4.0 to 4.5 with an oral length of 10 to 12 centimeters and nasal length of 12 to 15 centimeters. For 12 months to 24 months old babies, we use 4.5 to 5.0, and then for the oral length is 11 to 13 centimeters, while the nasal length is 14 to 16 centimeters. For children above 24 months, we have two formulas, one for the uncuffed tube, which is age in years over 4 plus 4, and for the cuffed tube, we use age in years over 4 plus 3, or age in years over 4 plus 3.5. For the ETT length, for the oral, we use age in years over 2 plus 12, and for the nasal, we use age in years over 2 plus 15. Here are some points to note. The first point is for children who have croup. This is because these children, they have marked narrowing of the upper airway, and a standard tube may be too short. So in such cases, we have a croup tube, which is extra long with small diameter. Some centers use cuffed endotracheal tube in all age groups, including neonates, with successful outcomes. In some cases in which it could be difficult to intubate a patient, a cuffed tube should be considered from the word go. Appreciate another diagram of a cuffed tube here. In patients with facial burns, cuffed endotracheal tube is recommended regardless of age. Thank you for watching. Like, subscribe, share, and comment. See you in the next video.